see everywhere around the state every day, and I'm grateful. Our approach is going to remain calm and steady. We're going to take urgent action when it comes to public health. Now, in Arizona, our timing has been later because our situation has been different than what you're seeing in other states, and it will continue to be focused 100% on the state of Arizona. And if we have a situation in a county or a hot spot, we will deal with that directly. And we're going to continue to have our decisions informed by data and public health. This is the White House gating criteria. Centers for Disease Control, along with the federal partners, put this together. It's the symptoms, cases, and hospitals. This is the same information that every governor in the country has been given. There's flexibility provided. You can act statewide or county by county. I'm going to take you through Arizona's numbers. On our symptoms, we're looking for a downward trajectory of influenza-like illnesses within a 14-day period and a downward trajectory of COVID-like cases within a 14-day period. This is Arizona's chart. The blue line is COVID-like illnesses. This is since December 29th. The gold line is influenza-like illnesses since December 29th. If you see the vertical line, about 2/3 to the side, that's where we put the stay home, stay healthy, stay connected order. You can see the downward trajectory in both COVID-like illness and influenza-like illness. You see this last week a slight uptick in the flu-like symptoms from 1.5% to 1.55. Just something to be aware of. Cases, a downward trajectory of documented cases within a 14-day period, or downward trajectory of positive test as a percent of total test within a 14-day period. Here are our cases by day, beginning with the day that the public health emergency was declared on March 11th. If you take a look at this chart, you can possibly see the beginning of a downward trend. The trend is not here yet, and we do fill these in over the last 4 to 7 days because the information hasn't yet been reported, but you can see these lines getting a little shorter, and this is something that we'll continue to monitor. Percentage of positive tests. Now, there was some misunderstanding around the tests. These are 100% PCR tests or diagnostic tests. There's no antibody test mixed in here, no serology tests. These are all diagnostic tests. The blue graph represents the testing blitz. You can see the increase in testing since we began the blitz on April 12th. And the gold line represents the percentage of positive tests. You see the 5 straight weeks of a decrease in terms of positivity, meaning the contraction of people that have COVID-19. You can see the last 2 weeks from 5.1% to 6% and 6% to 8%. So again, we're testing a lot more folks. We're having a testing blitz. We're down significantly from our high, but we want to see that line continue to go down. That's the trajectory that we want to see. Let's talk about hospital capacity. This is really how we measure not only who has contracted COVID-19, but who is sick and needs care and comfort. The gray in this graph represents availability. The blue represents inpatient beds that are in use, and the gold represents beds that are being used for COVID-19 patients. If you can see across the course of time, beginning on April 10th, that line remains pretty steady, pretty flat, somewhere between 10 and 13% of available beds. The takeaway is we have capacity of hospital beds if necessary. Intensive care unit beds, this is if you're extremely sick. Gray is availability, blue is ICU beds in use, and the gold is ICU beds with COVID patients. You can see the same, you see a slight uptick on May 24th and May 26th, but we're pretty much between 11 or 17 and 20% of available beds here throughout. Ventilators, we have a lot of availability. We have some ventilators in use, and our COVID use for patients with ventilators is pretty flat, consistent, and steady. The takeaway on ICU and ventilators is that we have capacity. If there were to be a spike in the state of Arizona, we are prepared with medical capacity. Testing. We want to have a robust testing program in place for our healthcare workers, including antibody testing and trace contacts of COVID-19 results. If you take a look at our testing blitz, began on April 27th. We've done a total of over 287,000 tests combined. That is over 200,000 diagnostic tests. That's the PCR test, the test that tells you if you are sick today. The other tests that we're applying are the antibody or serology tests. Those tell you if you've contracted COVID-19 and have since recovered. We're going to continue our testing blitz. We're focused on people that are symptomatic. People believe that they've contracted COVID-19 or have been exposed to it. We want to focus on where folks are most vulnerable. Our long-term care facilities, congregate care, assisted living, and state prisons. So I'm joined today on my left by Major General Mick McGuire, who leads up the National Guard and our effort at DEMA, and Dr. Kara Christ, who's the Director of Arizona Health Services, and she's going to take us through where we are regarding those objectives. So, Dr. Christ, welcome and take it away.
Thank you, Governor. So we continue to work on those populations and those areas that have been considered priorities. So we are currently in the process of testing residents and staffs in all of the Medicare certified skilled nursing facilities, and we are working to ramp up the testing in our assisted living facilities. So there's approximately 147 Medicare certified skilled nursing facilities, and there's about 2,300 assisted living facilities statewide. We're also working on getting our correctional officers access to serology testing, so that's the antibody testing. We continue to provide support to Navajo Nation, and then we're continuing to monitor some increasing numbers that we are watching in Yuma County. And so there are a couple of different things that are going on in Yuma County. We continue to provide support and testing for individuals and populations down there. One of the things that Arizona has done in preparation to ensure that we have ongoing hospital capacity is we established the Arizona Surge Line, and we're one of the only states to have this free 24/7 centralized call-in line for hospitals and their providers that they can call if they've got patients that either need to be at a different level of care, either higher or lower, or a hospital is concerned about their capacity or their ability to care for that patient. This was stood up in April. Over the last few weeks since it's been stood up, we have facilitated the transfers of over 400 patients statewide to the appropriate level of care. This is a real-time call that a hospital just has to make one call, and this line can find where the available beds are, where the available care is, and actually facilitate that transfer, taking that off of the hospital's responsibility so that they can go back to caring for other patients. There's an executive order that that will be released that requires the hospitals to actually utilize this. This actually was a partnership that we worked with the hospitals on. They voluntarily have been working on that and have provided resources to help assist the state stand this up. What it does do is it does require more frequent reporting of those beds so that we have a good idea of what's currently available when we need to find it. And then it will require them to accept patients when it's clinically appropriate and when their resources allow. The other thing that it does is it ensures that the patients who are transferred by no choice of their own because the surge line is coordinating their transfer, that it will be considered in-network by their insurance provider, because the last thing we want is for somebody to get transferred to a hospital that's out of network and have a large insurance bill. Thank you.
Thank you very much, Doctor. And now I want to turn it over to Major General Mick McGuire, and I want to thank him for his hard work, his double duty as leading the National Guard and taking over the DEMA effort as well, and talk to us about what's going on in Navajo Nation and the situation with supplies and PPE.
Yes, sir. Thanks, Governor. Appreciate the continued support. I want to first say that we're continuing our efforts to support not just Navajo Nation, but all the tribes we've, in the last week since we last met, have been able to send out some PPE training teams from our Task Force Med to Hopi Nation as well as White Mountain Apache Tribe, as they have also unfortunately had some cases on their tribal lands. We continue to provide Task Force Aviation support. Dovetailing on what Dr. Chris said, our UH-60 Blackhawks are part of that response network for the very remote areas of the country if we need to do transfer for certain patients based on criteria that we've established with health services. So we're proud to partner with them in that regard. And we are actively working with our federal partners and other volunteer organizations to provide staffing, and we have both of the 50-bed alternate care sites operating now in Chinle and Shiprock. As we go forward, we'll continue to maintain that presence, and we're thankful that not only the Guardsmen are supporting the folks on Navajo Nation, but all of the state. President Trump announced today that they'll continue to support that effort on Title 32 502F through mid-August, which I know was a national story recently. So we're thankful for his advocacy and the support of the governor as our Commander-in-Chief to continue that. As we work our way around, we still have the humanitarian mission going with the water tanks. We are post-mobilizing 3 of the 4 of them. The Navajo Nation has things under control in that regard, and we're continuing to monitor the situation there. We have a lot of outpouring of public support and donations, and we are able to execute just in the last week 4 specific missions from the food banks down in Santa Cruz County that have excess produce to move that equipment with our Guard Task Force Logistics and that food and supplies up to the northeastern part of the state. And finally, I would say, as we look at that trucking mission, the governor mentioned the PPE. We have a picture here of the past weekend. Fitting on Memorial Day, we were able to put a mutual aid request in with the state of California in coordination with Dr. Chris' staff. She has 5 folks that they've put on since this has started over in that warehouse. And that warehouse is relatively empty. On Sunday and Monday, we sent 13 trucks out to California. We're able to deliver 10 million surgical masks, 50,000 face shields, filled up the entire place. And with the help of just 16 of our Guardsmen and women that are there permanently assigned on 2 shifts and Dr. Chris' team, we were able to turn all that equipment around in less than 48 hours and deliver it to all 15 counties. And I can say, as the emergency manager and the commander of the Guard, there's a huge logistical effort to empty that warehouse. 13 full truckloads of stuff, repackaged, sent to all 15 counties. and I feel confident that we've gotten out ahead, at least on the surgical mask issue. We received 25,000 last week as well from Honeywell and their initial N95s. We're still continuing to work resourcing the gown issue, and I'm confident that our local Arizona economy will help us overcome that, sir. Thanks.
Thanks very much, General McGuire. Thank you to the brave men and women of the National Guard and the coordination that you've shown with the Department of Health Services. It's just been an incredible team effort. So let's talk about where Arizona is today. Of course, we're going to return the Arizona way, focused on our state 100%. Our announcements will be gradual and phased in as we come out of this pandemic. We're going to balance public health with returning stronger and believe we can do both safely and successfully. We're going to increase testing, and we're going to maintain strong physical distancing. Again, I want to thank the citizens for their responsible behavior that continues. And we're going to base the recommendations of CDC and health experts as we make decisions over the next several weeks. So I was able to meet with school leaders and superintendents from around the state earlier this week. I want to thank these people. Our hardworking teachers, principals, and superintendents really we all had a curveball that came at us in March. They did, especially because they were in the middle of the school year. They switched almost immediately to distance learning. There were all hands on deck. There was a surge of supplies and hot spots and technology. And by and large, they've finished out this school year or are completing it very soon. And we got together to talk about what's next. What does next year look like and the next school year? So I want to thank Superintendent Kathy Hoffman, who's been a partner and a leader throughout this in looking out for Arizona school children and what's in their best interest and how do we work with educators and teachers. We did a lot of listening in this meeting. We received a lot of input from leaders across the state. I would say the good news was no matter where somebody was or what their role was in the system, they were eager to get back inside a classroom, to get to the front of a classroom. So they're looking for clear guidance. Flexibility was the coin of the realm so that we could tailor guidance to meet the needs of the specific school district and the situation that we still have in the state of Arizona. The announcement today is that schools will resume at the start of this school year. We're planning ahead. Superintendent Hoffman will release guidance for schools on Monday, June 1st. This guidance has been informed, of course, by school leaders, teachers, parents, and public health experts from the Arizona Department of Health Services. In addition, we're going to have an executive order to support our schools. The superintendent's asked for flexibility around child care ratios for school-based child care programs. So we're announcing a responsible plan developed by health services that will protect children in school-based child care and will allow for increased child care capacity for school-aged children. We'll continue to work with school leaders to ensure the needs of the children around the state are met. In addition, I said that things would be getting back to normal when somebody could say play ball or batter up. I was hoping that play ball was for the Arizona Diamondbacks, but in the meantime, it can be for Little League. Organized youth activities can resume. So whether that's summer leagues, summer schools, or day camps, those are important. We wanted to provide clarity here. There is guidance to allow youth sports to resume safely and responsibly, so please feel free. Let's talk a little bit about returning stronger in our economy. Part of that is taking care of the 500,000 plus individuals who are displaced during COVID-19, the people that were working just a few months before and all of a sudden had no income and no job. We've worked hard to make sure that no one fell through the cracks and that our social safety net was strengthened and expanded. This is the unemployment benefits paid, and you can see the first real date where there was an increase was April 4th, just not that long ago. Over $1.4 billion that's been put forward in just a few months. That's over $983 million in unemployment benefits. In terms of pandemic unemployment assistance, those are individuals that in the past would not have been covered in a situation like this. Over $513 million put forward, and you can see the overwhelming majority of that over just the last 2 weeks. I want to say thank you to the hardworking men and women in the Department of Economic Security. We continue to make progress. This week alone, we've paid out over $188 million in unemployment insurance benefits and $218 million in pandemic unemployment assistance. DES has served over 700,000 Arizonans. 572,000 plus with unemployment benefits and 139,000 plus with the unemployment assistance for the pandemic. I know that there have been complaints, and I know that there have been frustrations, and we've worked hard to expand capacity, resources, servers, employees that are working there. They work through the weekend, Sunday and Monday of Memorial Day, but over 700,000 Arizonans have been served. There are more that need to be served, and we will work to do that and to get this right. But I want to recognize their effort because it has been extraordinary. We're also going to announce a new director of the Department of Economic Security today. His name is Michael Weishart. He's a career public servant, started his career 20 years ago at the Department of Economic Security. He has his undergraduate degree from Arizona State University and his MBA from Arizona State University. He's been instrumental inside the agency in the creation of the Department of Child Safety. He led the effort on Arizona's Second Chance Centers, our enrichment centers for child care for essential workers. Michael has been at the Department of Economic Security for 20 years. He has never seen a director promoted from within the agency. To our knowledge, he is the first director to be promoted from within the agency, and we have confidence that no one knows this agency better than Michael Weishart and that he will serve the people of Arizona well going forward. I also want to give a special thank you to Tom Betlak, who came out of retirement to take the lead at the Department of Economic Security in the most stressful, high-pressure time in the history of the state. He's an incredible public servant. It's when the state needed him most, he answered the call. He's also committed to providing assistance and counsel to Director Weishart through this transition. I'm thankful to Tom Betlak for everything he's done for the good people of Arizona, and I'm also thankful that he's going to help Michael Weishart with the onboarding to the leadership role at the Department of Economic Security. I want to talk about our local communities. We were able to meet with mayors and supervisors from around the state yesterday. The federal government has forwarded dollars to the state to not only support the state, but our local communities. I wanted to listen to the people on the front lines, and that's our mayors and our county supervisors in both urban and rural areas. We were able to have a couple of listening sessions with these folks. They told us what was most important to them, and we were able to make an announcement yesterday as to how we were going to disperse these dollars. There's $2.8 billion that was forwarded from the federal government to the state of Arizona. We were able to take these resources to local communities with $441 million for Arizona counties, cities, and towns. These are direct payments. They have maximum flexibility and minimal red tape for our mayors. In addition, we have $150 million in express pay resources. This is going to be Major General Mick McGuire working with local municipality to fast-track FEMA reimbursements for coronavirus-related expenditures. If you look at this $2.8 billion, we've got half of it that has gone out to local governments for their use, what is best and most necessary. I've always believed that the government that governs best is the government that's closest to the citizens, and we've got half the dollars in their hands. And with that, we'll take some questions.
Start with you and Howie. Hi, Governor. I appreciate what you're saying about sports, and I've got a question on that in a second for youth sports. But in the meantime, the Prescott Rodeo, the world's oldest rodeo, starts exactly in a month from now. Will they be able to have a rodeo, and will they be able to have people in the stands? Because without people in the stands, they ain't making no money.
Well, I hope everyone can hear the question. The question's the Prescott Rodeo's a month from now, and can they have a rodeo, and can they have people in the stands? The answer is they can have a rodeo. In terms of people in the stands, there will be more to follow on that. Of course, what we want to see today is strong physical distancing. But you're talking about July. That's light years away in the world that we're living in and the change that we've seen in the state of Arizona week to week. So there will be more to follow. But yes, the Cowboys and the Bulls can get ready.
Now, let me just follow up. I just want to follow up on the issue of youth sports. You said that they'll be able to gather. Again, this isn't like the NBA with negotiating. What about, again, people in the stands, parents on the sideline screaming? Are they going to be able to have spectators for these youth sports and these summer camp sports?
So in terms of youth sports, of course, the negotiations are complete and they're ready to have the first opening pitch for Little League. And we're proud of the players and the parents. This idea of physical distancing, responsible behavior is something we're going to continue to talk about. It's going to be important in any of these settings. There's going to be guidance that's put out by the Department of Health Services, but youth sports can resume. And do you want to talk a little bit about the guidance around that, Dr. Christ?
Sure. So there will be recommendations that involve limiting the number of parents or spectators that a child can bring, physically distancing before and after the game, not sharing drinks, snacks after the sports. If there is shared equipment, making sure that you're disinfecting it before and after, so that we do have recommendations that have been developed for our youth activities.
Thank you. Thanks, Howie.
Thank you.
Governor, on reopening schools, that's firmly in phase 2, and you're not there yet with your testing. That's a big leap to tell the parents of 1.1 million school children that it's safe to go back to schools when we have the most crowded classrooms in the country in this state. That's an anticipatory thing. Why, and you and Dr. Chris can both talk about what are you going to have to pull that back if things don't?
So I want to talk about this decision from a public health perspective. So I'm going to let the public health expert address it. Dr. Chris?
So for schools, we know that we've had daycare or childcare in place where kids have been in a congregate setting. There are a lot of recommendations. When we met with the superintendents of the school, there are multiple plans that they are putting into place so that children or teachers that are at risk can either do distance or virtual learning, that there are opportunities to reduce class size, and that there are disinfecting protocols, and a lot of safety things put into place. And this would be very flexible for both the families and the employees of the school district. The thing as a mom that I can't stress enough is that school supplies so much more than education. And so it's important to get these children back into school, back into a normal routine. Of course, it's going to be a new normal. Washing hands, hand sanitizer, physical distancing, not mixing at lunch, not doing big assemblies. And so they will be back to school, but it'll be a new normal.
Go to Stephanie and then Nicole.
I guess this question is for Dr. Chris. So this week, in terms of daily statewide hospitalizations, we saw two larger numbers than usual, 911 on Tuesday and 945 yesterday. Are you concerned about that? I mean, I think to members of the public that can look alarming. So how are you explaining that?
So the data that